Hi, I'm Lori from HIS Talk, and I'll be moderating today's webinar. Welcome, and thanks for joining us for today's HIS Talk webinar entitled The Role of Identity Management in Protecting Patient Health Information. It's supported by Caradigm. Attendee phone lines have been muted to prevent background noise. You can use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you'll receive a link to the recording as well as one to a PDF version of the PowerPoint presentation. Now I'm going to turn it over to Ozzie Same from Caradigm, who will introduce today's speaker. Oz?
Thank you, Lori. Good morning and good afternoon, and welcome to today's webinar featuring Mac McMillan. My name is Ozzie Same. I'm the product leader for Caradigm Provisioning. It's a great pleasure to be here for today's discussion. Mac McMillan is the co-founder and CEO of Synergistech, a firm specializing in information security and regulatory compliance within healthcare. Mac has over 30 years of experience in privacy and security in public, private, and nonprofit institutions, and he's considered a thought leader for our industry. He's the current chair of the HIMSS Privacy and Security Policy Task Force and was recognized in 2012 as a HIMSS Fellow. In today's session, you'll hear Mac talk about the importance of identity management and its role in supporting the organization's operational management of user access. You'll also learn how an effective identity management program supports compliance with regulatory requirements. And you'll come away with best practices for identity and access management that support an organization's ability to conduct audits and run investigations. And with that, I'll pass it on to Mac for the start of today's presentation. Mac?
Thank you very much, Oz. It's indeed a pleasure to be here today with his talk and Caradigm. I think for everyone, this is a session that will have a lot of meaning. This is a challenge that I think every organization in healthcare today faces. We all know the responsibilities we have when trying to provision users efficiently, being able to manage them throughout their life cycle, if you will, in the system, and then being able to remove individuals when they depart in a timely manner. And that job that have to perform has gotten more difficult over time, and there's a lot of reasons for that. So the first thing we're going to do is we're going to talk about those reasons, those challenges, and with respect to what I call a need for a new paradigm in terms of how we approach this. I'm going to talk over and over again about two concepts that I think are very relevant here. The first one being the operational impact of this responsibility. The second one being the compliance impact of managing user access. And I think also that it's important to understand that this is a business process, and ultimately we all are trying to do things like automate this process and make it easier, reduce the costs that are associated with identity and access management and the provisioning responsibilities, et cetera. Reducing the effort that our folks have to put forth to get this job done. Accelerating getting users into the system so that they can become more productive quicker. Improving security by reducing the number and the amount of errors through manual manipulation, if you will. And on the back end, being able to answer questions quicker with respect to access, with respect to supporting investigations or complaints or inquiries, and to be able to really manage those compliance responsibilities that we have out there. And so with that, let's first turn to some of those factors that I talked about that are affecting us. And I think the first one is no surprise to everybody. It's kind of a historical view of where we've been and where we are today. And it's in the environment, as we all know, or the ecosystem that we live in as it relates to identity and access management and users and systems, has just gotten more and more complex over time. You go all the way back to The beginning there with mainframes, it was a much simpler environment with respect to identity and access management. Client server introduced another level of complexity by introducing more systems that we had to authenticate to, and more systems that we had to have access to and manage that access. The internet and the advent of other systems that we could get to through the web introduced another layer of complexity and another layer of systems, or number of systems that we had to manage. And of course today, where we have a completely mobile environment in most cases, where we have things like bring your own device strategies that are out there, we have users using everything from phones to pads to laptops to mobile devices to medical devices to cloud-enabled systems to software as a service-enabled capabilities. We literally have a situation where identity and access management, quite frankly, has almost become, and I think I've heard it called this before, the new perimeter, if you will, for how we manage access to our environment and to our assets. So it's just gotten more complex over time. The second factor that I like to throw in there is of course, the evolving level of activity that we have. We have increased sharing with respect to HIEs, or health information exchanges, health insurance exchanges now. We have accountable care organizations. We have new rules as it relates to business associates, and we have to manage their access more closely now. We have new rules as it relates to research and compliance. There's just a lot of things that are adding complexity to the environment, which is one of the big challenges we have with identity and access management. The other thing, I think one of the other challenges we have when we look at all this activity is that we sometimes underestimate how important this process is, and we don't think of it as something that's really a business process as opposed to just a project. And then last but not least, the whole issue around authentication as it relates to managing our system more securely and that access more securely, and understanding how important it is to have increased or multiple factors with respect to authentication to make our environment safer and to protect those passwords even more. So there's a lot of complexity, a lot going on. The environment has changed considerably over time, and that's affected our user community. Our users now come at us from many different aspects and with many different contexts to how they access systems. In fact, a single user may access the system in many different roles today, more so than they ever have in the past. That's made for a much more dynamic access management environment, and it's caused us to have to reevaluate, if you will, how we look at how we manage access in our system. In a lot of our healthcare organizations today, we're talking thousands of users, and in many cases multiples of that with respect to roles and identities. This is not a trivial problem. It's a very serious one and a very big one. We have, in most cases, thousands of systems that we're managing access to, hundreds of applications. We have core applications that users have to have access to support operations, et cetera, and then other applications that are important to our processes. In many cases, users have multiple identities. They have multiple roles, as I said, that they play in our organization with respect to these various systems, and all of those things just serve to multiply this problem or this set of challenges even more and make it more difficult for those folks in IT and the business managers to actually understand and manage folks' access to the system. What this translates to then is essentially a set of trends. The first set of trends is in the compliance area, and that is that regulations and compliance requirements have continuously grown. They continue to grow. We've seen enforcement around these things also grow. As we know, there are requirements or drivers in all of the rules that we see here. HIPAA, high-tech have their drivers with respect to identity and access management, access control, audit, etc. The omnibus rule changed some of those requirements around certain systems and increased those requirements as it related to patient access rights, as well as other programs. Meaningful use has its requirements around the electronic health record and being able to manage access system very discreetly, each user having to be identified uniquely in that system. And there are other requirements out there that affect some of our organizations that are doing business either with the federal government or in other roles where they have to apply certain other regulatory regimes such as FSMA and other requirements that might be out there. As I alluded to, enforcement has become a big issue with respect to this, and in a lot of cases it comes down to being able to identify who's had access to information and what they did with that information when something has arisen or occurred that shouldn't have. As we've seen the rhetoric lately, there's been quite a bit of talk about the fines increasing with respect to organizations, and we've had a couple of fines come out here in the last month and a half. There's been quite a bit of change at the Office for Civil Rights. A new director has been identified, but not yet approved. But the organization that actually handles the settlements for OCR, that person has come out recently and said that they do expect to see more fines and they expect to see higher fines. And so it's just going to become more and more important that we have a better handle on what our users are doing, what systems they're actually accessing, and our ability to respond to those kinds of requests when they come up. We know also that the audits are going to begin again in October. I'm referring, of course, to the Office of Civil Rights audits. The audits that will begin in October are going to be essentially desk audits for this next wave, but they've already announced a third wave after that sometime next year that will be on-site audits again. So again, and we know during the actual audit process during the pilot year that access management, audit, etc., were all big topics for the OCR auditors, and we expect that will be the case again. So this is a real responsibility that we have from a compliance perspective, and it's something that we need to get a better handle on. When we look at it from a threat perspective, I think it's safe to say that when we just look at the magazines today or the news that comes out today, the threat environment that we live in from a systems perspective is continuing to evolve. It's continuing to become much more invasive. The threat to our systems as it relates to access is both internal and external, and it is very definitely something that is causing a lot of challenges for organizations. For instance, this year we've seen an upturn in the number of directed attacks. Whether these are malware that may have a malicious content that takes advantage of the system or a user and tries to get access to credentialing information to give access to a hacker to take advantage of our system, or it could be something as simple as a phishing email that is looking for that credentialing information that then compromises a system. We have seen numerous attacks this spring against a lot of large institutions that have created quite a bit of angst for folks. And then last but not least, there's always this operational impact that we have. And I think anybody that works in IT especially, or who has been on the compliance side of this in terms of understanding just how difficult it is to manage that user population, has become aware of the challenges that we have in establishing role-based access in large organizations, managing those roles, managing the groups of individuals in various roles, the multiple identities that individuals have, and the process of normalization of those identities for the purpose of even things like single sign-on or simplifying it for the user and helping them to synchronize identities and credentials. The transient nature of our workforce, a lot of our large organizations have folks coming and going on a frequent basis. That too adds to the operational impact of these processes. The number of help desk requests that we have seen increase as a result of having to better manage access in these very large environments with these increases in systems and delivery mechanisms. And then last but not least, just the time sink in terms of this, what's been, for the most part, very manual, time-consuming process that in many cases often leads to errors, just like any other manual process in the system, which can create challenges for us as well from the compliance perspective. So it really is something that has both an operational impact on our organization as well as very much a compliance impact. And all of this leads to consequences, if you will, within the system as it relates to impacts to the user and impacts to compliance. And when we look at the impacts on the operational side of the equation, there are essentially two primary impacts. And the first one is to that user experience. Again, the challenge the user has of managing multiple IDs, the challenge the user has of managing multiple passwords and having to change those passwords on a frequent basis. The challenge with operationally with having users sit and wait while slow manual processes go through to get people into the system and working, and the challenges that leads to on the compliance side when sometimes we take shortcuts to get people up and running when we don't quite have them accessed yet. On the system admin side, the folks who are actually managing this process, for them it's really been a tremendous challenge because they have the nightmares, if you will, of having to provision all of these many thousands of users that a lot of times that they're dealing with, the challenge of getting people into the system quickly so that they can meet those operational requirements of the business units, getting that provisioning correct. In many cases, they're dealing with both centralized and decentralized provisioning systems in terms of how they're managing that. As I said earlier, the help desk nightmares in terms of the numbers of requests that they get for folks who have forgotten their credentials or forgotten their logins and having to help with those account management duties. Just the technical nightmares in terms of synchronizing or trying to synchronize various logins and identities across multiple systems to try to make things simpler for users. So it's been a real challenge on the system side as well with respect to the IT folks. And then last but not least, obviously we have the compliance impact. When we make errors in systems, when we do things manually, no matter how good we are, we know that oftentimes things can go wrong. That leads to vulnerable accounts that are not terminated or taken out of the system when they're terminated, leave orphaned accounts out there that can be taken advantage of. Other kinds of accounts that aren't managed properly can then become mechanisms for inappropriate access. The difficulty in auditing, if we don't have good role-based rules for users, good provisioning, good identities, or identity management, it makes it very difficult to audit anything in the system. And of course, that then affects things downstream with respect to correlation of changes. And last but not least, manual processes a lot of times leads to incomplete information in the system. So there are some real challenges out there that are affecting our organizations and making the need for identity and access management solutions even more important today than they've ever been before. So let's talk about this identity and access management and some of the considerations that we need to take into effect when we're thinking about these things. I think it's safe to say that one of the biggest challenges, as I said before, is provisioning users in the system. And I've having worked with healthcare organizations now for the last 13 years, I've seen organizations struggle with this. I've seen organizations struggle with the many systems that they're having to manage. I've seen them struggle with the different types of systems that they're having to manage that require different types of credentials, if you will. I've seen them struggle with the number of users. I've seen them struggle with trying to develop or implement role-based access. And these are things that identity and access management tools help us to do. They help us to enable those processes of identity and access management, the rules around users with respect to privileges and attributes, etc. They help us to centralize a lot of those processes and make it easier to access individuals into the system by being able to create core sets of requirements in terms of groups and whatnot that you can quickly access individuals into, and then follow up with all the other accesses that they need after that. They help with password management. They make it easier so that the user doesn't have to manage that themselves so directly. And we make and enables stronger password management with respect to the types of passwords that we see in organizations that are using these solutions. So it allows us to codify those policies, to organize that role data, if you will, to manage those transactions with respect to our users. And on the back end, obviously, it's going to help with our ability to respond to audits and to inquiries and to improve or enhance our compliance posture. When you look at the modification side of it, which was one of the weaknesses that was identified clearly in the Office for Civil Rights audits during the pilot year, one of the things that they noticed was that we didn't, especially as we got into larger organizations where there were lots of users, lots of movement of folks, et cetera, multiple roles, that we didn't necessarily do a great job of managing those accesses and the roles that individuals had and the accesses that they had in those various roles, because again, it was a very manual process, as opposed to having a tool that is actively managing an individual based on a set of rules that are associated with a particular role, so that when we move that person from one role to another, that system automatically recognizes that there's a change and that change requires a change in the accesses that that person might have. So again, this ability to automate this process, to define those rules and those roles, if you will, and to be able to have the system assist us in helping to manage that change when somebody gets promoted, when somebody gets transferred, when somebody just literally changes jobs, et cetera, can significantly increase or enhance our ability to make sure that the person in a role has access to the right information. And last but not least, we always have the responsibility to take folks out of the system in a timely manner. And again, this is another one of those big areas that they always look at whenever they audit, and that is, how effectively do we remove people from the system? Do we eliminate those accounts, or do we have orphaned accounts sitting out there that can be taken advantage of? Again, if this is in a automated process where all of our roles are registered and the user is registered to a role, when the user is terminated, then those accesses are terminated automatically with them. So again, it helps with this whole process of managing the life cycle of the user from the time we actually provision them into our environment to the time that we actually retire them on the back end. I also want to talk a little bit more before we leave here about the importance of role-based access and how identity and access management tools help us to manage this very important aspect of this challenge, if you will. Almost everything we do in terms of identity and access management is tied to our ability to accurately identify the individual and define the privileges or the attributes of a particular role and the privileges of a particular user, and be able to tie those things together to understand that someone is actually accessing the right things at the right time when they're supposed to, and to be able to investigate or audit things that happen that seem to be anomalous. The ability to put users in roles, to be able to identify those roles, and to automate this process so that it is something that automatically happens when there is a change to this person's status, if you will, absolutely enhances our ability to manage this and to reduce the number of incidents that we might see happening. Identity and access management tools in particular help us to do this by automating this process and allowing us giving us a framework in order to work within, which is one of the difficult things that a lot of folks seem to struggle with when they try to do this in a manual fashion. The other thing it does is it absolutely assists in the onboarding of new hires, because if we can create this organizational structure around role and we can create these core accesses, profiles, if you will, that a user can be put into a particular group immediately, then we can absolutely get them operational a lot quicker than if we have to try to load their accesses independently or one at a time. So it's absolutely a time saver and an operational enhancement to the organization. So what I'd like to do now is kind of take a step back and look at a couple of examples. And these are examples from folks that we've worked with who have implemented one or more aspects of identity and access management. And one of the things that we did was we talked to them about what were the benefits of doing this. In other words, what kind of impact did you see in your organization as a result of implementing these kinds of capabilities, these kinds of tools? And so the first example here is of a fairly large independent delivery network. It's a 5-hospital system, about 14,000 users total, if you will. And what they did when they implemented identity and access management, or what they saw when they implemented it, was immediately they saw benefits in their ability to get users into the system quicker. They built that corporate profile that I talked about a moment ago. They built a set of accesses that an individual in a particular role would need to be functional when they came to work. And they were able to use a single sign-on solution to actually take and group those and simplify that whole process for those group of accesses and those group of users to be able to get them into the workforce even quicker. They also saw other benefits in terms of eliminating things. In this particular organization, one of the things that they had experienced was an external audit that said that they had way too many generic accounts. And part of the problem that they were dealing with at the time was that their provisioning process was completely manual. Once they went to an automated system where they were able to create roles for individuals and create groups and to actively manage those accounts, they were able to identify all those generic accounts and eliminate the ones that shouldn't have been there. They also were able to speed up the experience for the user by implementing a biometric proximity device, a tap and go device, if you will, with respect to their workstations, especially their shared workstations. They were able to provide their clinical staff with the ability to walk up to a workstation, touch that device with their badge, immediately bring up their accesses and their profile, and allow them to get in and do what they needed to do. And then when they walked away, all they had to do was tap it again as they walked away, and it logged them out. So it not only sped up the process for the user in terms of their ability to get into the system, but it also reduced the number of inappropriate uses of access accounts because the user was logged out when they walked away, and the next user that walked up did not see that account open. It also, by virtue of implementing single sign-on, it eliminated the memory issues that they had a lot with their workforce around passwords. Made it possible for them to use more complex passwords, and the users had less passwords that they had to change as often. But because they were able to tie this to their Active Directory and to their personnel system, it allowed them also to tie those roles to those users automatically in that system, and when there were changes to that person's status, whether it was promotions or transfers, etc., to a new role, it automatically forced an update to their accesses that the system was expecting. So again, it reduced the amount of time, it reduced the amount of effort, and it reduced the amount of errors that were associated with managing their workforce. And they said that it was one of the best things that they obviously had ever done from an operational impact perspective. The second example here is a very large health system. This health system has nearly 50 hospitals and 40,000 plus users. And they too were trying to find a way to simplify the challenges that they had with managing this very large user community in all the systems that they needed to have access to. So they too implemented an identity and access management set of tools, and they reported that their benefits were huge in the area of baseline provisioning, meaning, again, they created that baseline profile, if you will, set of roles for users in their environment that allowed them to take a new hire and get them on the job almost immediately. And then they had other accesses that were added after that at some point, but these were things that did not stop that person from doing their job immediately. And so this alone saved them a tremendous amount of time, and it also improved the experience with the worker, and it improved the relationship between the IT organization and the department heads who were waiting on those users to be able to get to work. So it shortened that time that they could get individuals on the job. It also, with the automation for them, reduced the manual intervention and reduced the number of errors that they had experienced. It allowed them, one of the things that they identified that the other organization didn't was it also provided them with better management of privileged users. One of the things that they were interested in doing was not just managing or understanding what the general user population was doing, but they also wanted to know what the user population that had privileged access or elevated privileges was doing as well, and being able to keep track of that and the impacts of that in the environment. So this gave them the ability to more accurately identify and manage those accounts and to be able to audit and look into, monitor what those folks were doing in the system. It provided better oversight, and it provided easier changes in the system. And they, too, linked their identity and access management tools to their personnel system so that changes became more automatic, and they were driven by those roles and those rules or policies that were in the system, as opposed to somebody having to go look up something or remember something or get a message and then put a user in a new account. So it just made it faster, more efficient, more accurate across the board. And last but not least, the thing that they were very interested in accomplishing by doing this was enhancing their ability to audit and to conduct investigations into access issues more efficiently. And they said that it provided them with almost a 50% drop in the amount of time that it took them to actually go through and resolve an issue around a particular user or group of users with respect to access. So there's real benefits to be had by automating this process and doing it in what I would refer to as a smarter way as opposed to a harder way. So the takeaways for me when I think about this and when I think about the folks that we work with is that this is a problem that has gotten to a point where both the compliance and the operational stress that's being put on the system by the many things that we've talked about has gotten to a point where we have to take a different look at how we're doing things. And we have to apply the right technology and the right tools to assist our folks in being able to do this more effectively. Even if you threw a lot of people at this, you still would not be able to do this as efficiently and as accurately as an identity and access management system that is managing these roles and these rules and these attributes for each one of these positions in an automated fashion. So really, we should think about identity and access management systems as a force enabler or as a force maximizer. It's going to improve compliance. It's going to absolutely improve our operational capability to manage this challenge and what users are doing in the system. It is going to shorten the time that it takes to do this and to get people productive, and it's going to absolutely help us on the back end when it comes to answering questions around compliance, if you will, or other investigative matters that might come up. So with that, I'd like to turn it back to Oz to have Caradigm give us their message.
Thanks, Mac. Really great discussion today. Caradigm's identity and access management solutions are part of a portfolio of products which include provisioning, our core identity management product, and single sign-on and context management. Our products are designed to protect providers from increasing security and compliance risk by safeguarding patient health information. And our products solve for a lot of the operational efficiency challenges that Mac talked about. And this includes fast, secure access to clinical applications and data. And this can be done either through timely provisioning of clinicians or through fast and secure access on the clinical desktop. Our identity and access management solutions are deployed in hundreds of hospitals around the world, protecting patient data and advancing efficiency. And some of the capabilities that Mac spoke of today are really central to our own provisioning product. Provisioning's control mechanisms enable role-based access to clinical applications and data, ensuring that only the right people have access. So this eliminates those risk vulnerabilities that Mac talked about, risk vulnerabilities like orphaned accounts and over-provisioned user access. Provisioning's password management capabilities allow uniform enforcement of secure password policies to also enhance security. And provisioning also addresses those real operational issues that many provider organizations suffer from, ensuring that users are set up into all clinical and business applications on day one. You know, the real value of a Caradigm identity management and provisioning solution comes in the stories that our customers tell of the impact our product has had on their own organization. And we welcome you to learn about these stories by reaching out to us or finding us on the web at caredigm.com. I would like to thank Mac for his time today. Mac, you've given us good insight into how identity management systems can play a role in protecting patient information. These emerging provider challenges really require a thoughtful discussion, and Mac is one of our industry's great thought leaders on security and privacy, and we are grateful for his leadership. And on that note, I'll pass it back to Lori to start our Q&A session.
Thanks, Oz. Now we'd like to open it up to the audience for questions. As a reminder, you can use the questions section on the GoToWebinar panel to submit your questions to Mac or to Oz. Our first question is, there are a lot of things we're working on in our organization. Identity management is something we've wanted to invest in, but it always takes a lower priority. What should I do to convince my manager that this should go from nice to have to need to buy?
I think the first thing that I would do is I would counsel that treat this as a business discussion. And what I mean by that is just as I talked about the compliance and the operational impacts of this challenge, I think that will resonate with the leadership a lot more than talking about this as a security problem, meaning the ability to better manage our workforce, to access our workforce into their jobs faster, to be able to move folks from one job to another more efficiently, and to make sure that wherever they're at, they have the right access to be able to do whatever it is the hospital needs them to do. And then the ability to meet our compliance responsibilities and our requirements around protecting access to patient information. As a compliance and an operational discussion, I would say if you show the benefits of that, the reduced time in provisioning, the reduced time in audit, the reduced number of errors in the process that affect users and their ability to get their jobs done, et cetera. If you show the business benefits of doing that, I think that's really what this comes down to. This is one of those solutions that is a game changer, that if you can do it, if you can get it in there, it absolutely changes your experience, it changes the workforce's experience, and it changes the organization's experience as it relates to managing this aspect of the business. And I think that's what you need to communicate to them. This is not just about security. This is about improving how we do our job at managing users and enabling their ability to work.
Okay, great. Thank you. The next one, how do you manage identity management and access for vendors monitoring or maintaining their systems remotely?
Oz, I'm going to let you take this question.
Yeah, so for our solutions, our solutions are really designed for those provider organizations that need to manage access for users that are on-premise. So that's the primary focus of our solutions. So it's really around those users that have access to clinical applications and data that are within the four walls of the provider organization. Now, for those organizations that have clinicians that access clinical applications or data remotely through some type of VPN access or something where they're not physically on site, our solution works just the same way because you're still connecting to those same clinical applications and data, so we can still manage those clinicians that have that type of access to those types of systems, even though they're accessing those systems from some remote location.
Okay. What types of in-house resources do you need to make an identity management solution successful?
Well, I think operationally, you're gonna need the same types of resources that you've always had, in the sense of folks that serve in those security administrative roles, if you will, or administrator roles around systems to actually manage that process still. I think from a technical perspective, again, this is something that we already have the folks from an IT perspective that you're going to need in this process as well. I don't, Oz, unless there's somebody in particular, a role in particular that you know of that's unique to this. I mean, it really, I think this is a tool that actually enhances or simplifies, and the folks that are already working this responsibility already.
Yeah, and I can maybe add a little bit of color on the actual implementations themselves. In order to be successful with the implementations, the types of our experience has been that there's a key set of resources that we leverage within the provider organization. From those folks from IT, those folks from HR, those folks from compliance, those folks from security, that are all part of the process for standing up an identity management solution. So there needs to be a significant stakeholder buy-in from all those key folks within the organization. What we also find that really helps in making these implementations really successful is that there's usually a champion within the organization. That can be the Chief Information Security Officer, that can be the VP of IT or infrastructure, that is really that person that tells the story, tells the narrative of the value of that solution, and somebody who can really champion those stated resources to ensure that they have success with their identity management implementation. So it's really about ensuring that you have that champion who is getting those stakeholders deeply engaged in ensuring that the project moves forward.
Has any organization used a self-service for account creation by users? For example, if I'm a new employee, can I create my own profile based on something Human Resources has already approved?
So I think the question is really around self-service provisioning, and the ability to actually provision users based on kind of this shopping cart of access that a person will want to have for to gain access to certain types of clinical applications. And these types of capabilities are certainly part of most identity management systems, including Caradigm provisioning. We have the ability to allow users to actually self-provision access into clinical applications, and this is certainly a component of our own offering as well.
Do the IDM products include CapOn technology?
So that tap and go technology that Mac referred to in the webinar, it really is central to the single sign-on and single sign-on technologies, and this is a technology that is core to our own single sign-on product offering as well.
Okay, that looks like it was our last question. So with that, we'll conclude the webinar. Thank you to everyone for joining us today, and thank you, Mac, for an informative presentation. Don't forget to keep an eye out for an email from us that will have a link to the recording of the webinar as well as a link to the PDF version of the PowerPoint presentation. I hope everyone has a great rest of the day.